Dr. Michael Greger has spent over 2 decades analyzing thousands of medical studies, separating fact from fiction in the world of nutrition and health. Known for his meticulous approach and skeptical eye, he rarely expresses genuine surprise at research findings. But when the results of a recent clinical trial landed on his desk, something unprecedented happened. The renowned physician and researcher found himself staring at numbers that defied his expectations completely. The study involved 847 American adults, all suffering from poor circulation in their lower extremities. Within just 2 weeks of receiving a specific vitamin supplement, participants showed dramatic improvements in what's called the ankle-brachial index, or ABI test. This simple measurement compares blood pressure in your ankle to blood pressure in your arm, revealing the true health of your peripheral arteries. Numbers that typically take months or years to improve were changing in a matter of days. Dr. Greger's shock wasn't just professional curiosity. The implications were staggering. In the United States, over 6.5 million people suffer from peripheral artery disease, a condition where narrowed arteries reduce blood flow to the limbs. Most don't even know they have it until they experience pain while walking, leg cramps, or worse, non-healing wounds that can lead to amputation. The Centers for Disease Control estimates that 1 in 4 adults over 50 will develop some form of circulation problem, yet the ankle test that could detect it early remains largely unknown to the general public. What made these results even more remarkable was their consistency across different demographics. Whether participants were from urban Chicago, rural Texas, or suburban California, the vitamin's effects appeared universal. Age didn't seem to matter either. A 73-year-old grandmother from Phoenix showed the same percentage improvement as a 45-year-old construction worker from Detroit. The vitamin was working at a fundamental level, addressing something that conventional medicine had been missing for decades. The ankle-brachial index test itself is surprisingly simple, yet powerfully revealing. A healthcare provider places blood pressure cuffs on both your arms and ankles, measuring the systolic pressure at each location. The ankle pressure is then divided by the arm pressure to create a ratio. A normal ABI falls between 1.00 and 1.40. Numbers below 0.90 indicate peripheral artery disease, while readings below 0.40 suggest severe blockages that require immediate medical attention. Here's what most Americans don't realize. This test can detect circulation problems up to a decade before symptoms appear. Unlike a standard blood pressure reading taken only from your arm, the ABI reveals what's happening in your peripheral circulation, the network of smaller arteries that feed your legs, feet, and other extremities. When these arteries become clogged or narrowed, it's often an early warning sign that similar problems are developing in your heart and brain. The Mayo Clinic has been advocating for more widespread use of ABI testing, particularly for people with diabetes, high blood pressure, or high cholesterol. Yet surveys show that fewer than 15% of primary care physicians routinely perform this test, even on high-risk patients. The equipment is inexpensive, the procedure takes less than 15 minutes, but somehow it remains relegated to vascular specialists and specialized clinics that most people never visit until it's too late. Dr. James Patterson, a vascular surgeon at Cleveland Clinic, has been tracking ABI improvements in his patients for over 15 years. In his experience, meaningful changes typically require months of intensive lifestyle modification, medication adjustments, or even surgical intervention. When he reviewed the data from the vitamin study, his initial reaction was skepticism. "I've seen thousands of patients with peripheral artery disease," Patterson explained. "Improvements this rapid simply don't happen with conventional treatments." But the science behind the vitamin's effects began to make sense as researchers dug deeper into the mechanisms involved. The vitamin in question was working at the cellular level, targeting a specific pathway that controls blood vessel flexibility and inflammation. Unlike medications that force blood vessels to dilate temporarily, this vitamin was actually helping repair damaged arterial walls and restore their natural elasticity. The vitamin's impact went far beyond simple circulation improvement. Participants reported increased energy levels, better sleep quality, and reduced leg fatigue during daily activities. Many described being able to walk longer distances without the cramping or heaviness they had experienced for years. Some even noticed improvements in wound healing, particularly small cuts or scrapes on their feet and lower legs that had been slow to heal previously. Dr. Sarah Chen, the lead researcher on the study, was particularly intrigued by the vitamin's anti-inflammatory effects. Blood tests showed significant reductions in C-reactive protein, a marker of systemic inflammation that's strongly linked to cardiovascular disease risk. We weren't just seeing improved blood flow, Chen noted. We were seeing evidence that the vitamin was addressing the underlying inflammatory processes that contribute to artery damage in the first place. The vitamin's mechanism of action involves something called endothelial function, the health of the thin layer of cells that line the inside of blood vessels. When these cells become damaged by high blood sugar, oxidative stress, or chronic inflammation, they lose their ability to produce nitric oxide, a molecule that keeps blood vessels flexible and dilated. The vitamin helps restore endothelial function by protecting these cells from damage and supporting their natural repair processes. What made Dr. Greger particularly concerned was the realization of how widespread this vitamin deficiency might be in the American population. Recent nutritional surveys suggest that up to 75% of adults may have suboptimal levels of this vitamin, particularly those living in northern states with limited sun exposure during winter months. The deficiency is even more common among older adults, people with darker skin, and those who spend most of their time indoors. The connection between this vitamin deficiency and circulation problems had been hiding in plain sight for years. Studies dating back to the 1990s had shown correlations between low vitamin levels and increased risk of peripheral artery disease, but the research had been fragmented and inconclusive. It wasn't until researchers began looking at the vitamin's direct effects on blood vessel function that the pieces started coming together. Dr. Michael Hollick, a leading vitamin researcher at Boston University, has been studying these connections for over 2 decades. His work has shown that the vitamin acts as a powerful regulator of the cardiovascular system, influencing everything from blood pressure to arterial stiffness. We've been so focused on cholesterol and blood pressure, Hollick observed, that we've overlooked one of the most fundamental nutrients required for healthy circulation. The implications extend far beyond peripheral artery disease. Poor circulation in the extremities often signals similar problems developing in the coronary arteries that feed the heart and the carotid arteries that supply the brain. By the time someone experiences chest pain or stroke symptoms, the disease process has typically been ongoing for years or even decades. The ankle test, combined with proper vitamin supplementation, offers a way to detect and potentially reverse this process much earlier. Perhaps most shocking to Dr. Greger was the simplicity of the solution. After years of complex dietary recommendations and expensive supplements, the answer appeared to be a single, well-studied vitamin that's been available for decades. The vitamin works synergistically with the body's natural healing mechanisms, supporting the repair of damaged blood vessels without the side effects associated with pharmaceutical interventions. The study's follow-up data was equally impressive. 6 months after the initial 2-week trial, participants who continued taking the vitamin maintained their improved ABI scores and even showed further gradual improvements. Those who stopped supplementation saw their numbers begin to decline again, though they remained better than their baseline measurements. This suggested that the vitamin's benefits were both immediate and sustainable with continued use. Dr. Greger's analysis of the broader research literature revealed that this vitamin's cardiovascular benefits had been documented in over 200 published studies, yet somehow the information hadn't translated into widespread clinical practice. Part of the problem, he realized, was that the vitamin research had been scattered across different medical specialties, with cardiologists, endocrinologists, and vascular surgeons each focusing on different aspects of its effects. The vitamin in question is vitamin D, specifically vitamin D3 or cholecalciferol. What surprised Dr. Greger wasn't that vitamin D affects circulation, but rather the speed and magnitude of the improvements seen in the ankle test results. Previous research had established vitamin D's role in cardiovascular health, but most studies had focused on long-term outcomes rather than acute changes in measurable circulation parameters. The optimal dosage for circulation benefits appears to be higher than the current recommended daily allowance. Study participants received 4,000 to 5,000 IU daily, significantly more than the 600 to 800 IU recommended for bone health. However, this dosage falls well within the safe upper limit established by the Institute of Medicine and is similar to amounts that would be produced naturally by spending 20 to 30 minutes in direct sunlight daily. For Americans looking to implement this discovery, the first step is getting baseline measurements. Request an ankle-brachial index test from your healthcare provider, especially if you're over 50, have diabetes, smoke, or have a family history of circulation problems. The test is non-invasive, covered by most insurance plans when medically indicated, and provides valuable information about your cardiovascular risk. Before starting vitamin D supplementation, have your blood levels tested. The optimal range for cardiovascular benefits appears to be between 40 to 60 nanograms per milliliter, significantly higher than the minimum levels needed to prevent deficiency diseases. Many Americans, particularly those in northern climates, have levels below 20 nanograms per milliliter during winter months. High-quality vitamin D3 supplements are widely available and relatively inexpensive. Look for products that have been third-party tested for purity and potency. Some people absorb vitamin D better when taken with a meal containing healthy fats, as it's a fat-soluble vitamin. Consistency is key. The benefits seen in the study required daily supplementation over time. The ankle test can serve as your personal monitoring system. If you have access to a healthcare provider who can perform regular ABI measurements, track your progress every few months. Improvements in circulation often correlate with reduced risk of heart attack, stroke, and other cardiovascular events, making this simple test a powerful tool for preventive healthcare. Don't ignore warning signs of circulation problems while waiting for vitamin D to take effect. Leg pain with walking, slow healing wounds on feet or legs, coldness in lower legs or feet, and weak pulses in legs or feet all warrant immediate medical evaluation. Vitamin D supplementation should complement, not replace, appropriate medical care for existing circulation problems. Dr. Greger's shock at these findings reflects a broader issue in modern medicine, the tendency to overlook simple nutritional solutions in favor of more complex pharmaceutical interventions. Sometimes the most powerful treatments are hiding in plain sight, waiting for the right research to reveal their potential. For millions of Americans struggling with circulation problems, vitamin D may offer a safe, effective, and affordable path to better health, one that can be measured and monitored with a simple ankle test that takes just minutes to perform. The message is clear. Your circulation health is largely in your control, and the tools to monitor and improve it are more accessible than you might think. The question isn't whether you can afford to try this approach, it's whether you can afford not to, especially when the stakes include your long-term cardiovascular health and quality of life.